Hello, my name is Frederica Harris, and I will be presenting on how to successfully negotiate managed care contracts. The first thing we want to think about is what is a managed care contract? A managed care contract is just a negotiated financial agreement between a payer and an organization. Benefits of a managed care contract would be it represents a percentage of revenue for an organization. It also yields additional dollars by preserving revenue through new products and models. Finally, it enhances patient satisfaction by streamlining access to comprehensive services and treatment. So let's talk about steps to negotiate a successful contract. First, you want to set relationship goals. Then you want to consider other options beyond those rates. And then go beyond not just addressing only the hospital. You want to think about your physicians, your ancillary providers. They can be your durable medical equipment. It can be your labs or lab providers or your radiology. Then you want to go ahead and develop a pair profile. And then also, finally, you want to keep your open options. So the first steps to negotiating a successful contract would be set relationship goals. You want to think about the type of relationship you want with the pair. Then you want to decide whether this will be a short-term or long-term partnership. Because partnerships will differ from short-term agreements because the partnerships you may be more interested in affiliations such as new products or risk-sharing models, which may consist of risk as well as profit. The next step when negotiating a contract would be look beyond just rates. You want to consider how the pair will affect your organization's workflow. So again, you want to be like how responsive or determine how responsive is this pair with claim issues. Does the pair resolve claim issues quickly or not? The next thing would be implementation process of procedures and new policies, or newsletters or bulletins posted on the website or emailed to the organization. Next, you want to think about do they even allow delegated credentialing? When we talk about delegated credentialing, do they allow organizations to credential their own providers if guidelines are followed or adhered to? Because with the organization performing their own credentialing, that gives those physicians the opportunity to get up and running quicker, and then also allows the patient to have quicker access to new physicians. And next, you want to think about the types of products offered. Do they offer value-based care or tiered networks? So if providers provide high-quality care at a low cost, or they tiered at a higher level. So next, you want to think about going beyond addressing only the hospital. When we're talking about from an integrated healthcare perspective, negotiations are a bit more complex for multiple service lines because you're dealing with multiple service lines. Things you want to think about are increased rates and offsets. Will there be increased rates for different service lines? Will increased rates offset decreased rates for other service lines? And then you want to focus on net change across the organization, as this will assist you in effectively negotiating a dynamic agreement for the entire organization. Next, you want to develop a pair profile. You want to contact the pair to obtain key information. And some of that would be consistent of what are the pair's goals? What does the pair want to accomplish in this agreement? Okay. And then you want to identify any new promotion of products. And then determine if the pair outsources. Because outsourcing can affect your organization if there's a lack of communication from the outsourcing provider and the pair. Example would be authorization is required for a particular procedure or service, and your organization is unable to obtain one in a timely manner. This can affect your organization significantly. Next, you want to view the claims history of an existing pair. You want to determine how much revenue is generated by the service line because it can impact your service line significantly. Again, especially if 30% of revenue is for a particular service line. You want to talk about you're thinking about your outpatient service, your inpatient service, your neonatal intensive care unit, and your diagnostic imaging. The next step to developing a pair profile, you want to examine recurring negative patterns with a pair, such as denial issues, or you have any issues with denials on certain HCPCS codes or CPT codes. You want to be sure that you're transparent to develop a profitable partnership between you and the pair. The next step into developing a payer profile will be to contact your organization's revenue cycle team to determine what is working and what is not. And some departments may be your registration department, your insurance verification, your billing department, medical records department, as well as your denials management department. Then you want to question current payer issues that your organization may be having, such as responsiveness. You want to identify, is the payer responsive and handling issues in a timely manner? You also want to question the knowledge of the payer representative, just to determine if the payer representative is knowledgeable, as this will be an indicator if your claims will be processed. That payer representative should be knowledgeable about what's covered and what's not covered. And then lastly, the desire to solve issues. They should be willingly to solve any issues. You may have issues with unresolved claims. You may have an escalation spreadsheet, and it may be ranging from a few months to years. These are some things that you want to think about when developing a payer profile. The last step to negotiate a successful contract is just keep your options open. Be ready to collaborate and compromise. You want to focus on market demand. Partner to reduce costs for your members. And also think about reward outcomes and performance. Think about not only your organization's needs, but also consider the payer goals and what they expect to achieve from negotiating the contract with your organization. Remember, the contract should benefit both parties. Then the end result will be an effective contract negotiation. This article was dated April 24th, 2013. There's a more updated version dated April 28th, 2023, but the information is basically the same. This is my reference. If you have any questions, please let me know. Thank you.